Yeah, sure.
Yes. So I'm sure none of us are so stupid enough to do something in front of everybody. And the law does understand that because sexual harassment is never done in front of public, you may not have direct evidence, direct proof, documents for them. Although these days, WhatsApp has become a very, very important channel on which everybody talks. And I was just examining 400 pages of WhatsApp exchange, okay, between a complainant and a respondent in the period of 6 months. So that is where the law's critical aspect, which I want all of you are, as you know, because we are also psychological expertise, and it is all to do with everybody's unwelcome and welcome behavior. Somebody calls me sweetie, but for somebody it may be okay if you call something else. So the line which rules this act is anything which is unwelcome, physical, verbal or non-verbal conduct of sexual nature. So it has to have a sexual nature, okay? So I just go to my boss and I ask for 2 days leave and he starts shouting, no, how you can get it? That is not sexual harassment. But supposing he crosses his line and he says, Arey, I'll get so bored without you. Let's go out in the evening for coffee. This is the crossing of line that each one of us have to be tuned to. Okay. We have to read those lines. How are we crossing the lines? And then to provide a safe workplace, I'm sure all of you are also working at your wherever you are. Providing a safe workplace is not very easy, let me tell you. Okay. You have newer challenges every day. You have new employees joining. You have new vendors who are joining. Your clients are new. Your situations are new. And so let's say in a school, when you say school, I would be so concerned about the children. So when there are two laws which are ruling, I would still like that my children, our children, whenever they go to school, are safe and away from this word called sexual harassment. So all said and done, I have done 500 and more of sexual harassment from 2013. December 2013 is the time the act came, and my work started maybe around April 2014. So from that day till today, more than 500 cases of sexual harassment. Also, I thought COVID would give me less cases, but COVID gave me maximum cases. Okay. I have come across a lot of false cases. The reporting is out of 100 women, only about 8-9 were reporting earlier, and after Me Too, it became 12 and 13. So when women, it's not easy for women to report. Now, all of us are women here. What do you think? Is it easy for women to report? I would like to get views on this. All of you should speak. Is it easy to go and report? It's very difficult, let me tell you. First of all, if it is against your boss, very, very, very difficult. If you are married, again, very difficult. Because how are you going to go home and explain what happened, okay? If you are unmarried also and you're living in another city, like currently I have a case of 2 doctors and they are oncologists, okay? That it happened in Indore. And she's unmarried and she's from Calcutta. She said, I cannot tell my parents that this is what happened to me here. So our social context, of course, now it's improved a lot. I would only say because I have not come across a lot of false cases. Okay. So women using this law to settle scores with men. It sounds also so difficult, isn't it? Even if I'm hearing it, I don't like it. So as women, and wherever I'm an external member, my training is very, very, very focused. I speak about a safe workplace. And for a safe workplace, each one of us have to first understand that I need to be safe, isn't it? Can I give my safety responsibility to somebody else? Can I say my boss will take that responsibility? Can I say the CEO will take that responsibility?
Harshada ma'am, your mic is on mute.
Say, no, the CEO only has atmosphere. Where are you all able to hear me now? Are you all able
Now we
to hear
can.
me?
Now we can.
There was a call. I'm traveling, that is why. So the best message that I can share with all of us, that as individual persons, we need to realize we have to be safe. Okay. So when we are safe, we also are going to be very responsible in our behavior, isn't it? I'm sure we can be friendly to everybody, we can talk to everybody, we can go out for parties, but we are not going to enter into a situation where somebody else becomes unsafe because of us. Once we take that responsibility, then now what we have to work on is how somebody else can make you unsafe or make me unsafe. That's where we need, okay, support. Now what support we need? First support that you will need is from your organization. So let's say if they make you sit late, okay, it's almost 8 and 9 and 10, then they have to ensure that you reach home safely. Supposing you also have to travel, you are in sales team and you travel a lot. So these are the safety measures that every company should take, and they have to mandate this law. Let me tell you, if you do not mandate this law, your license can be revoked. Okay. There are a lot of companies whose license has already been revoked. They have to close down their offices. Okay. In Mumbai, Uber had to close down their office once because of sexual harassment. Now, if you see Nanavati Hospital, I don't know how many of you know Nanavati Hospital. Nanavati Hospital, nobody reported the case, neither the complainant, neither the respondent. Who reported a case on Twitter? You'll be surprised. A patient who was sitting out, he saw something going on and then he reported it on Twitter, telling in Nanavati Hospital, this is what happened. IIT, all big names are there in this. IIT, something that we look forward, that, my child should go to IIT only, I'm sure. Okay, everybody will hope so. IIT, they had to tweet to the minister, the student, and they have also said that in IIT, the atmosphere, the ethos of IIT is such that a lot of feminism against, a lot of anti-feminism activities are going on. So all said and done, I'm sure corporates would also like to be known as a safe workplace. Secondly, as individual employees, and then we are all professionals, okay? We are all experts at mental health. We also have to ensure that wherever we are contributing, we should contribute for a safe workplace, a safer individual, and I'm sure over a period of time, some rape percentages, or maybe, somebody being treated badly on the streets, these percentages will surely come down. Now, the last part of my talk, and after that, I'm going to hand over to Dr. Wilona. It is very difficult to investigate on a case. Please take it from me, because you have the powers of the civil court on one side, and you have principles of natural justice. So on a legal part of it, we need to be very strong, okay, as external members. Let's say a person like me. External member is mandatory on every internal complaints committee. So I am there on at least 20-25 companies. I'm there on their internal committees, including, let's say, Asian Art. So I should just tell you the name of institution. So very reputed institutions, okay? But all said and done, when you're investigating on a case, okay, these days you get a lot of support from the management. Tell me why? Only because now they have to declare that I'm providing a safe workplace, let me tell you, okay? But going down the line, the awareness is very poor on PoSH, okay? And that is why I thought, our own, we have a nice network now. Our own network should, I'm going to give you a very short modular, you won't get bored, I'm sure about it. But let's say, when this girl said that my boss tells that you come and, we will have a live-in relationship. He also told one another girl, chalo live-in mein rehte hain. Oh, the other girl was very happy. She said, yeah, as it is, I have to spend 30,000 on rent. I don't mind sharing the room with you. So how are we going to judge what is going to be okay for somebody and what is not okay for somebody? So difficult, isn't it? When one girl was not happy, the other girl said, I don't mind. So each one of us, I'm literally telling you, Dr. Vishaka also said, with the transformation from Vishaka guidelines to the act, at least one thing is good, that they have made ICC mandatory. If you do not have your ICC, again, your license can be revoked. And you have to also submit an annual report to Government of India. So this act is well made. Let me tell you, false, if there is a false complaint, your ICC declares it's a false complaint, then you have the powers to terminate the complainant. So it is not a feminist law, let me tell you, okay? But I am quite happy with it, because when we speak of a safe India, I'm sure all of us are covered, isn't it? I mean, my family, my children, my local community, my workplace. And that is why, as a safe workplace, we should create a safer India, is what I feel over a period of time. In whichever fields you all are working, okay? All my WICCI friends, still you should take PoSH everywhere, okay? Because it is definitely one added advantage, a skill set, which is added to your current skill sets. So you need any help, okay? But each one of us have to be safe, and we also have to look at a safer workplace. So thank you very much. I have only requested Dr. Wilona because we need to also understand sexual harassment and mental health. So Dr. Wilona, all yours now. And then we have 10-15 minutes for questions. Okay? Thank you, doctor.
Thank you, Harshada ma'am. Thank you so much. It was very interesting listening to some of your sharings, and I hope to have an opportunity to actually listen to a more detailed version of your session today, because this was a very brief conversation that we are having in
You
conjunction.
can join me on Monday if you want. Monday I am at SEBI. I'm talking to the SEBI officials. Okay. If you are
Okay,
free, you
ma'am.
can come with me.
I'll touch base with you about the timings, ma'am.
Okay. Okay. Continue, doctor.
All right. So good evening, everybody, and thank you so much for making the time to attend our session today. In fact, some of you are dear friends, the ones I'm seeing on the screen, and I'm so grateful that you all could come, even though I shared the invite just this morning or afternoon. So I have prepared a short presentation for my part of the session, and I'm going to quickly share my screen. Balvinder, just give me a thumbs up if you can see the screen, please. Awesome. Thanks. Okay. So we are going to talk quickly about sexual abuse and mental health. And when we come to the context of sexual abuse and mental health, we are talking about several areas of work. As mental health professionals, each one of us works in different contexts with the physical, psychological, social effects on survivors, perpetrators, their networks, and their communities. I don't know how many times I have seen this happening in the clinic, that a patient has come to me with anxiety or depression or even focus related concerns which are academic. And when we dig a little deeper and when we try to understand ki kya ho raha hai, what's the background to it, we find trauma, and behind that trauma we find abuse. So we work with the survivors, we work with the perpetrators, and we definitely also work with the community. That is the area that our work encompasses, because we have to support whoever comes to us, irrespective of which part of this they belong to. Now, when we look at the effects, we know that trauma is very deeply impacting in different areas. In fact, when patients come to me with a long-standing history of depression or a persistent depression, one of the things that I look at is, where is the trauma? Where is the history of abuse or trauma that is happening? Because whether it is a stranger, somebody absolutely unknown, somebody the person did not have any connect with, and even more so if it's an acquaintance, someone they knew, someone they trusted, someone they actually expected to be a support or someone that they would trust, the effects of trauma are far reaching and impacting each and every individual to a very significant extent. Of course, one of the effects is that it significantly impacts the survivors' personal relationships and their work performance. And therefore, in the context of PoSH, understanding the impact that it has on the person is going to be very important. Within the workplace, especially when the employee was supposed to be safe and discharging duties on behalf of the organization, when something like a sexual abuse occurs, it is now mandated that the third party assistance that is to be provided should be provided as far as possible free of cost, and it should take care of the safety of the individual. So today let's talk about the different kinds of impacts that it has on the survivor. Now, when you look at the psychological effects of sexual harassment on the survivor, you have a lot of guilt and self-blame. We see this very often when we work with cases in the OPD. There is a significant amount of guilt that the person has. They don't even, yes, Sonam is saying they don't even realize that they are victims of sexual harassment. But there is this unspoken thought that maybe I was responsible for it somehow, So there's a lot of guilt, there is a lot of self-blame, there is a lot of self-deprecation that is involved on the part of the survivor. You may see irritable mood, anger outbursts. I have one patient who is now seeing me, who has been through multiple psychiatrists, who, when she got to me, said that, Dr. Wilona, I cannot, I have been in a very bad shape for the last 1 year. I have been seeing at least 6 different psychiatrists. Everybody has given me medications. Not one has listened to me, and I can't afford to pay your fees. Are you still willing to help me? And the one concern that came out as she was talking to me was that she was irritable and angry and getting upset over small triggers. Now, even things that she realized were not sufficient enough to cause that much irritation and that much mood swings, she was noticing that irritable mood. Of course, there's going to be difficulty concentrating. When our mind is preoccupied with a stressor, it is absolutely difficult to focus on things that we are otherwise required to focus on. There could be insomnia, sleep-related difficulties. There could be fatigue and change in energy level. There could be anxiety and a hyper alert kind of behavior. So even a small sound or a small disturbance in the background may trigger a very hyper vigilant kind of reaction. There could be fear for personal safety, sometimes rational, sometimes irrational, but there could be a fear for personal safety. At times, there might be so much worthlessness, hopelessness, and helplessness that they may even feel suicidal. There can be the later impact in the form of post-traumatic disorder, and we can see various forms and degrees of depression in the survivors. So we definitely see a far-reaching impact of the psychological effects of sexual harassment on the survivor. But what about the victim? What about the perpetrator? We talk about the victim, we talk about the survivor. What about the perpetrator? What are the reasons? And these next few slides have been taken from a very detailed study that was conducted on the perpetrators of sexual abuse and sexual violence. Post hoc, the reasons that were given by the perpetrators were that it was not their fault. It was actually the fault of the victim or the survivor who pushed them to behave in that particular manner. They often use this to, justify their morally reprehensible behaviors at points, and also to absolve themselves from the guilt, the shame, the embarrassment, and the revulsion that comes with the idea of engaging in an act that transcends boundaries of human behavior. They also say that they, especially when there hasn't been any guilt or any remorse that is exhibited based on their behaviors, if the lack of remorse is visible, then it could indicate a likelihood of them feeling comfortable in engaging in this behavior again in future situations. So we need to be aware of this when we are evaluating and examining perpetrators, because the remorselessness is a very important factor that would point towards the antisocial personality trait that the person comes with, which could then be an indicator for us for the amount of intervention that we would need to engage in. The reasons that are given, very often these reasons are expressed by the men or the individual in the role of the perpetrator, that the woman or the person concerned was seductive, that the thought or, and these are also termed as sexual abuse supportive attitudes, an attitude that when women say yes, when women actually say no, what they actually mean is yes, they're just saying no because they are shy or they don't want to express what's going on in their mind, but the actual thought is yes. When they were asked about, whether they realized or whether they felt that the women were enjoying it, most of them also reported that eventually the woman relaxes and enjoys it with absolutely no importance given to the fact that the woman was threatened into it or the person was placed in a position where they had no option but to finally give in. Then there is the attitude that nice girls don't get raped, or you could have a reputation for being sexually promiscuous. So if you're wearing revealing clothes or willingness to go somewhere with someone alone, then that could point towards an invitation to be treated in a particular manner. They brought the rape on themselves or wanted to be raped because they flirted with them, and that it was only a minor wrongdoing. It was not intentional. It was not intended to harm or hurt the other person. So several sexual abuse supportive attitudes contribute to thought paradigms that lead to people believing that this kind of behavior is something that is okay. That is something that we can't fight against, that we cannot defy or, create a sort of wall between ourselves and the behavior. So when they examined the characteristics of sexual assaults, few characteristics that came out very prominently were that most of these assaults occurred among people who already knew each other, typically were already in some kind of actual or potentially a romantic sexual relationship, or even when they were simply hooking up. So the characteristics that were noted to be common were these 6 characteristics. 1, what was the expectation of sex from men and women? So very often, men and women have different expectations of sex. Usually men tend to expect sexual activity in situations where women might not really anticipate the incident or the activity to actually turn into a potential sexual encounter. Then again, there are several misconceptions that people hold about sex. And a lot of these misconceptions are fueled by wrongful education about sexual awareness. And here I am reminded of an incident where I was taking a session on sexual abuse for members of the staff at IPH, of the helpline at IPH. And I just threw open the question, ki, when do you think is the right time for people or children to be educated about sexuality and sexual awareness? And I'm going to throw that question out to you guys in the chat box. Please feel free to type out your answers. When do you think is the right time to educate a child about sexuality or sexual awareness, so that the misconceptions do not permeate into their learning? I'm waiting to see your responses in the chat box. If someone wants to unmute and answer, they're welcome to do that, but it would be lovely to see the responses in the chat as well. When do you think is a good time to educate children of our community on sexuality and sexuality awareness? Lovely. Vishaka says 0 to 5 years. Anyone else? Same, Harshada ma'am?
As early as possible.
Superb. Balvinder, Srilata, everybody. As soon as they take admission in school.
As soon as possible, yeah.
Superb. I'm glad that all the mental health professionals at least have their concepts clear. Because when I talked to that team, many of them were debating, 8 years, 10 years. And then I had to reset expectations and say, no, it's not so late. As soon as possible. As soon as the child starts talking or thinks or even starts developing awareness about their body, is a good time to talk to them about sexual awareness, so that misconceptions do not permeate into our community. Then again, the level...
I have Dr. Wilona,
yes,
I have a granddaughter who's 6 years old. She knows exactly where somebody does not have to touch her.
Absolutely. So I remember...
you have to start, and including for boys.
Absolutely. I remember doing the, understanding my amazing body as well as good touch, bad touch with my kids as young as 3. So I know that it is important that we start these conversations as early as possible. Another factor that plays into sexual abuse incidences is the amount of alcohol or drug consumption on the perpetrator's part as well as the victim's part. And a lot of cases that were studied, especially in this particular study that I was looking at, the amount of alcohol consumption here, but in other cases that I've seen in the OPD, the victim or the perpetrator being high on certain substances played a huge role in their behavior beyond a particular time. Of course, not condoning the behavior, not accepting the behavior, just talking about the factors which interplay into the sexual assault. Then again, how much does the person who is abused or who is the victim agree to attempts to being taken alone? That was another factor that was reported in the characteristics of sexual assault. And if there was already consensual sex that was going on between the two partners, somehow the concept that if they agreed to sex one time, after that every time or any other form of sexual activity was going to be acceptable seemed to be the thought process that was there. So these are characteristics that I want you to keep in mind when you are talking to victims, perpetrators of sexual abuse, so that you are able to understand the situation, the challenges that they faced, and then work through their challenges in a stepwise manner. Okay, moving on. What can you do? So, as mental health professionals, I have put together specific slides to show you what you can do. The first and the most important thing is that it is important for us to create wider networks of support systems. Okay, I know that at a workplace where a person has struggled with sexual harassment or sexual abuse, they will feel extremely singled out or sidelined or specifically targeted if they are told, you go and meet the counselor, you go and talk to the counselor. And if they have to go and do it within the confines of that office space, they feel the eyes of everybody on them as they walk towards the counselor's cabin. So it is important for us to create a wider system, a support system within the community where they can reach out and take help whenever they feel the necessity for it. And here we will need to adhere to principles of confidentiality, safety and security, respect and non-discrimination. It is going to be very important for us not only to get carried away by whatever they tell us, but to look at it in the light of a non-judgmental mental health professional, understand the challenges that the person may be facing, and then help them in a holistic manner. So essentially, our support should be multi-level. I have included a slide on the community level intervention and the individual intervention that you can do, and we'll come to that in a bit. But concentrating on the individual survivor, the survivor's immediate family, and the social network could possibly be the first step. Any kind of psychological first aid that the person requires, whether they require a detailed debriefing, allowing them safe space for venting, sharing their emotions, expressing whatever is happening for them, and offering them support in a realistic manner so that they can reach out and take help whenever they require, is going to be important. It is also going to be important for us to remember that we are not going to be able to battle this alone. So linking them with other services that are available. For example, whenever I have a victim of abuse that comes to me, I often ask them to reach out to Sneha or to some other NGO which may have the bandwidth to support them with all the necessary supports that they need, whether it is legal aid, whether it is social work, whatever other support that they need. I try and make it possible for them to make sure that they're able to link to the other services. And in certain cases, they will require specialist mental health care, whether a psychiatric referral, a psychological evaluation, counseling support, or any other support that they may require, they could possibly benefit from. We also need to look at community-focused interventions. So we need to now look at changing the psychosocial programming of the community. So in acute situations, what is the intervention that needs to be done? Educating the community, explaining to people, talking to the media, highlighting how such cases should be addressed and reported and taken care of is going to be one important part of our intervention. Another important part is to create safe spaces for women, which necessarily are socially inclusive and address the stigma that is associated. Harshada ma'am spoke so well about how difficult it is for the woman to come forward and report. And if we do not create that inclusive space, if we don't address the stigma that is associated with it, we are not going to encourage reporting, which is then going to ensure that this doesn't progress further. So we need to address the misconceptions that people have. We need to address the doubts and queries that they have. We need to help build up interventions that protect their dignity, promote their psychosocial well-being, and eventually prevent mental health problems associated with sexual violence. This is the chart that I was talking about. When you talk about person-focused interventions, you require specialized services, which could include psychiatrists, psychologists, psychiatric nurses, all the gamut of medical professionals that work with the individual. But non-specialized focused support could be basic emotional and practical support, linkage to health services, basic mental health care by primary health workers, community workers at delivering emotional first aid. All of this could be integrated into our system so that people are able to manage on all these levels. Regards the community, what we need to do is awareness sessions. Today, you are mental health professionals attending this program. Tomorrow, you could probably go out and create awareness in your own communities. Tell them about what sexual abuse means, what consent means. And that reminds me, there's a beautiful video that Tinder has put out on consent. Go on YouTube and check it out. It's really nice. It's a longish video, but it's so good. And I think it talks beautifully about the concept of consent. Today we had very limited time. Otherwise, I would have made sure to share the video in our session today. But you can definitely go back and look it up. We also need to look at how we can strengthen the community and family supports, self-help, resilience initiatives. And if we can, create policies in place to ensure protection, health services, nutrition, food aid, all of the other support that is required as a community to ensure that we are providing safe enough spaces for each and every one who needs to reach out for help and support. I think this brings me to the end of my presentation. I'd just like to end with this quote: "Our lives begin to end the day we become silent about things that matter." I think each of us needs to be that voice that raises awareness, creates questions in people's mind about what is, what has been, and what should be further. So I hope this short discussion has helped ignite some thoughts in your mind. And both Harshada ma'am and me are here for any questions that you guys might have. We would like to end at 6:20, bearing in mind that it's a Saturday evening and everybody has their plans. So if any questions, please go ahead and unmute and ask, or you guys can also put it in the chat and we're happy.
You know what? Thank you, Dr. Wilona. You know what? All of us who are here today, first thing that you should let us know is how much does this topic make sense for you all, okay? Now, you have questions, please put in the chat box. We will answer it and give it to you later. But I would like to have a network of safe workplace with you all. Okay? And we should meet like how we meet here. One of our chapter would be safe workplace. So park your questions with us. We'll not take a lot of time today. I want you all to just think about it. Thank you, Dr. Wilona. It was beautiful, I'm telling you. It was just too good. I'm not a doctor, so I can't explain as you are, because I'm a practitioner. So I know only how to resolve cases, If there's a case, I know ki kya karna hai. But you explained it so beautifully. I'm just getting down out of my cab. So for 5 minutes, I hand over to Dr. Wilona and maybe Palvinder, and then I join in. Okay, I'm here only.
Yes, thank you, ma'am.
Yeah, thank you, Dr. Wilona. Thank you, Harshada. And I am a teacher. And when you were talking about, various, you can say, symptoms when you can make out that the person is in trouble. And I have come across 2-3 times certain cases when, I deal with mostly 9th and 10th standard students. So there have been cases where children are undergoing one or the other kind of sexual harassment. So, and at that time, I'm talking like some 5 years back, I was not equipped to deal with it also, because till that time I was not, I had not done my course in counseling and all that, but still I tried at my, whatever was possible for me at that level. speaking to the mother of the child and all that. So can you just guide that if we come across such incidents where we know that child is able to confess, or we give a safe space where child can tell actually what is happening, what is the next step? What should be done then after that? I am like, okay, now I know a bit about mental health and counseling, but my other colleagues, they are not. So if such cases we come to know, what should be the next step?
Okay, so we are talking about PoSH today, but what you are talking about would come under POXO. So I would say that the first thing that we will need to do is mandatory reporting. Okay, that is the first thing that we need to look at, because we do not want the perpetrator to engage in similar behavior with any other child. So one intervention as a community is to create awareness and steps for mandatory reporting. Now, all of us are mental health professionals here. I'm sure each one of us would have had one case at least where there is a sexual abuse or some trauma that is related to sexual assault in your kitty, in the number of cases that you've seen in all your years as a mental health professional. How many of us have actually reported? And do we know the mechanism or the means for reporting? That's, yeah, Srilata, go ahead. You're on mute. Can you unmute? Yeah.
So the first few cases of sexual abuse that I encountered was when I was working in a school as a school counselor, and at that time POXO was not in effect, and so that was a very hard place to be in, because we used to go from Prafulta to conduct some life skill sessions in a particular school, and children, quite a few, would actually come after the session and say that, well, there's a family member who's touching me in this way and that way. In one particular case, we went to the child's home to tell the mother of the child that, this is what was happening. The child was actually withdrawn from school. So even, at that time, it was, I know, like you said, this comes under POXO. But in terms of the reporting, even at that level, I'm saying, at that time, schools were not prepared to take a stance on it. And, it was something that happened outside of the school, and therefore, it had to be dealt with by whoever. So it was a very, I used to get a very helpless kind of a feeling of not just being able to do enough. Now, of course, I think it's mandatory even under POXO that anyone whom the child approaches would have to report it to the authorities and get it done. Yeah. So yes, I have not reported this, but in other cases that I have encountered of sexual abuse cases that have been mostly in the family, where it's all about hushing up the whole thing.
Yes.
Yeah, and unfortunately, but yeah, I think I recognize the need to be more proactive.
Thank you.
I would like to just add here that even before reporting, the first step needs to be believing the child.
Absolutely.
Because any one person, whether it is a counselor, the teacher, or whomsoever the child has felt confident enough to share with, that person firstly believing the child that yes, this has happened with you, and this is not a figment of your imagination, or or going into blaming, or going into a lot of negative reactions that typically come the child's way. So that would be the first step. And of course, as a responsible person, in case of whether you are a teacher or a counselor or whomsoever, the second step would be according to me, would be have a written report and submit it to the concerned management authorities for further action. So, wherein complete details are taken in, and including the name, whoever the child names that so and so has done this, whether it is in the school environment, whether it is at the home environment, or wherever. So, writing a report makes it formal, makes it the way in which it can be, further action can be taken upon it. And this is done with the consent of the child. The child is shown that this is what is going to be presented. Of course, if the child is young, then it has to be with the consent of the parents. that this is what we are going to, record and report so that action can be taken upon it.
So I've had a few cases where children have come forward and talked about concerns, and because I specifically work with both the autism spectrum population as well as the intellectually disabled population of children, in those cases, then the reporting has accidentally happened. In a case where the child was exhibiting certain sexually active kind of behaviors, which then indicated that, okay, there's something that is going wrong, because this child should not be able to exhibit these behaviors at those age. And that's when after a lot of probing, it was found out that it was a family member that was assaulting. And in both the cases, the parents point blank refused to report because it was a family member. In one case, it was the mother's cousin, and she was terrified that if the father found out, he would stop her from all ties with her side of the family. So we had a lot of work. In fact, I think it took her nearly 6 months to tell us that this was what had happened, even though the complaint that they brought the child to me with was that the child was trying to get under the clothes of everybody, and trying to see the private part. So it was very strange, the behavior that the child was exhibiting. So I agree with the order that Vishaka has said, but I would still work on emphasizing that from our end as professionals, reporting has to happen. And I don't know if Harshada ma'am wants to throw some light on the process of reporting and who we need to report to, so that we are clearer from all of us.
Yeah. So as per this act, if you have anything which is making you unwelcome, uncomfortable, you have to approach your internal complaints committee, which is mandatory if you have more than 10 employees. Okay. They, as I said, they have the powers of the civil court. They are bound by the clause of confidentiality, and they have to give fair judgments, is what is their role. They also have principles of natural justice. Plus, they have only 90 days within which they have to resolve a case. So, it's quite a tight investigation that they have to do. In case you have a case, then you can call both the parties and get it reconciliated also. And if the complainant says no reconciliation, then there is proper investigation. So all said and done, the process is very well laid, okay, as far as the act is concerned. Do read the act if it interests any of you. It is a very interesting act and a very small act, not a very big act also. And it has a lot of, one annexure is on rules. So please do that also. But I think today we should, it's an initial meeting. I'm so glad. Even if it interests only 10, 12 of us, it's okay. Doesn't matter. But this 10, 12 can make a difference to the lives of many 20,000 and 40,000. Okay. So this is how I'm looking at. Please park your questions. We will answer as and when we go, maybe in a day or two. Dr. Wilona and myself will answer it. As I said, Dr. Wilona is more like a doctor, and she gives a medical and a therapeutic answer to all this. And I would be more like, an investigator. So I know how to just get the cases done fast. And that too within the framework of the act. So thank you very much, each one of you, for being here. We are surely, if you all are interested, we can surely have regular meetings on the same. Okay. With this, thank you very much. We hand over to Balwinder now. Balwinder, all yours.
Yes. Thank you, Dr. Wilona. Thank you, Harshada ji. And both from different perspectives have given us a lot of information. And I was not aware that ICC is mandatory, and if even like workplaces have to provide a safe solution in case they are asking the employee to wait for a longer period and all that. So it was, I should say, an awakening session. And as rightly said, a lot needs to be done on this. And first of all, awareness. Okay. So let's see, let's reflect that how we can do something. As you rightly said, that we should go through this first, and it will be great if we can have more meetings about this and have more clarity on this aspect, because it was a topic I feel is very wide, and the time today is quite less. We need at least 2-3 more sessions to get the understanding, so that we can talk to other people with whomsoever we are in touch with within our environment. Like in my case, of course, I every day deal with almost 200 children. And if I am aware of something, then definitely, I can provide the correct information. I don't want to just provide a superficial information. I want to go into the depth of it so that I can give a right perspective to children also. So it will be great if we can have more meetings, and whatever the short one was also very, very impressive and educational also. Okay, so thank you very much once again, Harshada ji and Dr. Wilona, and hope to see both of you very soon about the same topic. Thank you on behalf of all the members of WICCI also.
Thank you. Thank you.
Yeah.
So I'm looking at a, helpline on PoSH. See if anybody wants in it, if it interests you, okay? And it also a consultation, like somebody just wants to consult. Okay, so maybe we can have a small core group who can, consult. So thank you very much once again. I should just tell you where I am. Today I am at St. Regis, where there is a town hall for Mumbai, arranged by all CNN. And that is where I am today, okay? So just entering the meeting now. Thank you very much, all of you, and we meet again. Thank you, Dr. Wilona, for taking my invitation. Thank you. Thank you, Balwinder, and bye, Dr. Vishaka, and all of you. We meet again.
Okay, bye-bye. Thanks
Bye.
a lot, Dr. Vishaka also, please giving
Yes.
the right process, first of all, very important to believe the child.
There are a lot of newcomers, Balwinder.
Yeah.
I can see there is Fauzia, there is some Mr.
Shilata
Vinod,
ji is there. Shilata ji is, if I'm not wrong, from Prafulta.
Sujata.
You are from Prafulta? Okay.
Yeah,
so
there
I
are
have
lot of
heard about
newcomers.
Prafulta in TISS. I've heard a lot of, yeah. So,
And she stays right next to TISS also.
oh, okay. Great. So you are in
Even I
Devnar.
stay next to TISS.
Yeah, Harshada ma'am, you and Srilata are neighbors, I think.
Right.
Oh,
I
Where are
recently
you,
moved though.
Srilata?
I
Where do you
recently
stay?
moved. I used to stay on Devnath Farm Road, near the new campus of this Zenith Park. It's a colony.
Yeah, correct.
Yeah.
Zenith Park.
But I recently moved from there, so yeah, I'm in Chembur, but not on that road anymore, Wilona.
Okay.
We are in Chembur. We can catch up very soon.
Yeah, I have to make a trip to
Okay.
Chembur
Yeah.
soon.
Okay.
Bye,
Thank
all
you.
of you.
Bye, everybody.
Bye.
Enjoy your Saturday and tomorrow
Yes.
Sunday also.
Thank you.
Okay. Bye-bye.
Bye.
Thanks a lot. Thank you so much.
Bye. Thank you.
Bye-bye.
Thank you.